All right, let's jump right in. Every single day, you breathe in and out, mostly without even thinking about it. But have you ever really stopped to consider the incredible journey that air takes? Well, today, we're diving deep into the powerhouse that makes it all happen, your respiratory system.
I mean, just think about this number for a second. You're going to take over 20,000 breaths today. And the wild part is, you don't even have to think about most of them. They just happen. It's this incredible automatic piece of biological engineering.
So, what if we did stop and think about it? What is actually going on with every single one of those breaths? Let's do that right now. Let's follow the amazing journey of just one breath, from the air all around you, deep into your body.
Okay, so our journey starts with the basics, kind of like looking at a roadmap. We're going to trace the exact path that air takes as it comes into your body and travels all the way down into your lungs, where, all the important stuff happens. It's not just a straight shot down. It's actually a pretty complex path with 5 main stops. It all starts up here, in your nose and mouth, which basically act like a combination air conditioner and filter. From there, the air travels down your throat, through your main windpipe, and then into this incredible branching network of airways that just keep getting smaller and smaller, until finally it reaches millions of these tiny little air sacs. And that's it. That's the destination. That's where the magic happens.
And what's really cool is how this whole system is split into 2 distinct zones. You've got the upper tract, which is kind of like the gatekeeper. Its main job is just to get the air ready and act as your first line of defense. And then there's the lower tract, the gas exchanger. That's the main event, where your body finally gets the oxygen it desperately needs and dumps the carbon dioxide it doesn't.
All right, let's start at the top with that gatekeeper. What happens when that first line of defense gets attacked? When it's overwhelmed by germs or irritants. You've probably felt this before. That awful, painful, throbbing pressure right in your face when you've got a really bad cold. Yep, that's sinusitis. What's happening is the lining of your sinuses gets all inflamed and swollen, blocking everything up. This traps all the mucus, creating this intense pressure. And yeah, unfortunately, a perfect warm, swampy playground for bacteria to thrive. And all those miserable symptoms? They're a direct result of that trapped fluid and pressure building up. The pain in your face, the stuffy nose, that brutal headache, it's all because those cavities that are supposed to be filled with air are now swollen shut and totally waterlogged. So, how do we fight back? Well, we bring in the decongestants. And what's really interesting here is that there's not just one way to tackle this. Topical and oral types, they work by literally narrowing the blood vessels in your nose. That reduces the swelling and lets everything, drain out. Steroids, though, they take a totally different approach. They go straight to the source and fight the inflammation itself. But hey, it's not just colds that cause all this stuffiness. If your blocked nose also comes with a side of sneezing and itchy, watery eyes, you're probably dealing with allergies. And that means your body is having a very specific and very powerful chemical reaction. And to fight that, we use antihistamines. See, when you run into an allergen, your body kind of freaks out and releases a chemical called histamine, which causes all those terrible symptoms. Antihistamines are like a bouncer at a club. They stand in front of the door, the receptor sites, and they just don't let histamine get in. No connection, no miserable swelling, itching, or runny nose. It's pretty clever.
Okay, let's keep going. We're moving deeper now, into those smaller, branching airways of the lower tract. This is the gas exchange zone, right? So when problems pop up here, they can directly mess with your ability to breathe.
Now, 2 of the most common issues down here are asthma and COPD. They can seem pretty similar on the surface, but there is one huge fundamental difference, and it all comes down to a single word: reversibility. With asthma, the airways tighten and swell up during an attack, but that can be reversed. COPD, on the other hand, involves progressive, long-term physical damage to the lung tissue itself, and that damage isn't fully reversible.
And if we go even deeper, right to the end of the line, those alveoli, that's where a really serious infection can hit, pneumonia. It's devastating because it causes those tiny, absolutely critical air sacs to fill up with fluid or pus. It basically floods the exact spot where oxygen needs to get into your bloodstream.
So, with all this potential for gunk, irritation, and infection building up, how does the body clean house? Well, its first line of defense is a reflex we all know and sometimes hate: the cough.
I know, it's annoying, especially when you're trying to sleep. But a cough is actually one of the most important defense mechanisms your respiratory system has.
You really can think of it as your body's built-in forceful eject button. It's just a powerful blast of air designed to clear out anything that shouldn't be there, whether it's a piece of dust or a glob of mucus.
But sometimes that reflex needs a little help, or maybe it just needs to be quieted down for a bit. And this is where it gets super confusing at the pharmacy, right? Because not all coughs are the same. We can basically break the medicines down into 3 types. Antitussives are for shutting down a dry, hacking, useless cough. Expectorants help thin out mucus so your cough can actually do its job. And then you've got mucolytics. Those are the heavy hitters that actively break down really thick, sticky gunk.
So here are the main players, the active ingredients you'll actually see on the box. Dextromethorphan basically tells your brain, hey, stop with the coughing. Guaifenesin makes mucus thinner and easier to cough up and out. And acetylcysteine, well, it chemically dissolves thick phlegm.
And here is a wild little fact for you about that last one. Acetylcysteine, the powerful mucus buster, has this whole other secret identity. In the emergency room, it's the #1 antidote they use to protect the liver from a Tylenol or acetaminophen overdose. It's the same drug with 2 totally different but totally vital jobs. How cool is that?
I mean, when you step back and think about it, from the simple in and out of a breath to this amazingly complex system of defense and filtration and repair, it's just an absolutely incredible machine. And it works nonstop for you, every second of every day. So here's a thought to take with you. What's one simple thing you can do today to help protect this amazing system?